All right. Why don't we kick things off? Welcome everyone to the first Apollo Practitioners webinar. If anyone can't hear me, please just make a note in the chat and I'll make sure to be more audible. I am your host for the next hour. I'm Dr. Dave Rabin. For those of you who don't know me, I am a psychiatrist, board certified psychiatrist and neuroscientist, and I have a clinical practice that is currently seeing patients and has been for a number of years, practicing a number of different kinds of psychotherapy as well as full-scale psychiatry that takes into account Western training behind Western medical training and Western psychiatric training, but we also take a very holistic and functional medicine approach where we include a lot of work with talk therapy, lifestyle approaches, nutrition, and things of that nature that help us to provide a more whole sense of the healing process for people and really to empower our clients to expand their sense of what health really means and find that for themselves. So we have had a number of other clinics that I work with over the years have had really great results using Apollo with their clients for a number of different symptom management and complex patient issues. And so we put this together based on requests to chat more openly about, while Apollo is not currently a medical device, it is a technology that is going down the path to ideally become something that we can talk about as having indications for use to treat different medical conditions. And we're on the way, but in the meantime, currently, Apollo Neuro is a consumer wellness wearable device. It is not a medical device. And this webinar is not intended to provide medical advice in any way, but we are happy to share this information with you to help you in any way provide better care to your clients, to your patients, just through the fundamental understandings of the nervous system and the neuroscience that we'll talk about today, and also how to use different kinds of technology to augment outcomes for clients. Particularly those who are having a hard time with autonomic disturbances and generally trauma, more generally speaking. So where we're at today, I think it's a good place to start because PTSD, post-traumatic stress disorder, and traumatic brain injury as well, which was also classified similarly back in the early half of the 20th century, was known as shell shock because it was something that was experienced very commonly in people who came back from war and from serving. And so this was actually the reason why the NIMH, the National Institutes of Mental Health, was founded. And we still, to this day, over 70 years later, have not had very substantial breakthroughs in the treatment of PTSD and traumatic brain injury, which is really unfortunate. And the reason why I start with PTSD is because this is what got me into this space, was studying people who had treatment-resistant post-traumatic stress disorder and working with my patients who had this illness, many of whom were veterans. We really were trying to figure out other alternatives that were not addictive and were not harmful in terms of side effects that could help empower these people to really change the course of their illness. And that was really where Apollo came from. And so seeing that to date, we had only had 2 FDA-cleared medications for treating PTSD, which were sertraline, Zoloft, and paroxetine Paxil, which both have negative side effects, both have less than a 30% clinical remission rate when you follow the protocol. And there have been no new FDA-approved treatments for PTSD in the last 15 years with an over 50% clinical remission rate, which means that when you see somebody who has a diagnosis of PTSD or somebody who doesn't have a diagnosis of PTSD, but who may be expressing symptoms or may have had a number of other traumatic events in their lives in the past, these people, when they go through the treatment that Western medicine considers the gold standard, over 50% of them are still symptomatic after more than one trial of treatment. And that is a really unfortunate and sad number for us to have in the field of mental health. And it is a very poor statistic that needs to be remedied. And so what this forced us to ask back in 2017, when these numbers were still current as of that time, it forced us to ask the question of, do we have this right? Do we have the understanding of what trauma really is and what chronic stress is and how it impacts people? And is it perhaps could we revise our understanding of trauma, and would that change the way that we treat patients and improve outcomes and possibly lead to a new therapy, which is where Apollo came in. So this started out with an understanding of what is trauma. And when we went back and asked the question, there were lots of different definitions, but they seem to all be related back to this definition that I'll give from Rachel Yehuda's presentation or interview with us a while back, which is that it's a past experience that we continue to feel is deeply distressing or disturbing, which means that and this could be physical, mental, emotional, or spiritual, and we can't necessarily know that the trauma is a trauma when it's happening, right? It's based on a past reflection of that trauma, on that event, seeing that it had continued effects 3 months, 6 months, 9 months, 12 months later. And again, a lot of these can be physical as well as mental health effects. And trauma can be caused by intense high concentration or density of stimuli. It can be caused by intensely meaningful, so very meaningful stimuli, self-relevant or self-referential to how we see ourselves in the world, and threatening, perceived or actual fear of survival. And I think the question that comes up in our treatments often is, does the memory of the event really matter? And that's something that we might get to by the end. And I think the answer is that it doesn't necessarily matter, and we can still do a lot of work with people even if they don't remember the event. So one example of this is burnout trauma. Burnout is something that is now declared as a World Health Organization critical issue as of 2019, and it's considered an erosion of the soul caused by a deterioration of one's values, dignity, spirit, and will. This is something that is then sub-characterized into, by exhaustion, depersonalization, and lack of efficacy. But it's something that many of us have faced, particularly as healthcare providers, on a frequent basis, or we've seen our colleagues experience it, and certainly our clients. And this is one of the major traumas, work trauma, that people are experiencing every day currently that is being unaddressed. But the WHO drew attention to it, so hooray. And what does this look like in most people? Well, it looks like someone's body perceiving threat from something that's not actually threatening, i.e. his computer, or Tim is having a stress response where his sympathetic tone goes up, his blood pressure goes up, his heart rate goes up, his HRV, heart rate variability goes down, he starts sweating, he starts panting. All of these things happen in response to receiving an email notification or a text message notification about work. And our bodies, while they are designed evolutionarily over millions of years to respond to stress in a very calculated and programmatic way, we are not designed to respond to stress every moment of the day, all the time. We're designed to respond to a threat that is typically something relegated to lack of air, lack of water, lack of food, lack of shelter, lack of acceptance by our community. These kinds of things are the things that evolutionarily were meant to trigger that fight or flight response that helps us get into a state where we are able to deal with the threat and get to safety. But when we get to safe place, then we're supposed to have reminders of that safety that calm us down and settle the blood pressure, settle the heart rate, increase heart rate variability, and help our bodies enter a more parasympathetic recovery dominant state. And unfortunately, this is not happening. And the consequence in our day-to-day lives in most of Western culture. And the problem is that not only does that chronic stress result in what we can measure now with most consumer wearables as a decrease in heart rate variability, the rate of change between, or the amount of time between each beat as it changes over time, which is one of the most now reliable metrics of our ability to track the effects of chronic stress. We see that this also results long-term in depression, anxiety, and even physical illness, cardiovascular disease, and sudden cardiac death. So people with low HRV are at risk, heart rate variability are at risk of all of these things. And we've never had a biomarker for mental illness like we do now. And we know that this is important because all of these big companies are creating technology to track HRV. And HRV, again, is related to this chronic stress pathway where sympathetic nervous system activity goes up in response to stress. It's meant to. We're not supposed to sleep when there's a lion lurking outside our tent. We're not supposed to be empathetic and sensitive in that situation either. We're supposed to get out of that situation to a state of safety. However, when that system is always active, that sympathetic system, and it's always perceiving threat and always sending our precious resources and blood and oxygen to our skeletal muscles, our heart, our lungs, and the parts of our brain, our amygdala, that are responsible for fear responses and getting out of and away from danger, all the other parts of our bodies, our reproductive system, our immune system, our digestive system, our recovery and sleep system are all getting deprived of those nutrients and deprived of that blood oxygen. And so this results in loss of emotion control, poor sleep, poor focus, and increased blood pressure and heart rate over time. And we see the opposite happening with techniques that improve parasympathetic tone, the recovery safety response system that is turned on literally by safety and improves control of emotions, improves sleep, improves focus, and can be measured by improved heart rate variability and decreased blood pressure and heart rate. And all of these techniques on the left here, all of these techniques are able to improve reliably parasympathetic tone over time, and sometimes in the moment in the case of breath, and are able to shift the balance of the nervous system back into a state of safety. The problem with these techniques is that they require effort by the individual in most cases, or they require somebody else to be there. And so we're really looking at is maintaining a balance, right? So this is health is homeostasis, and homeostasis means balance. And this is our body and our mind's ability to restore balance to our bodies when there are changes in the environment around us. So when stress comes, our sympathetic nervous system is supposed to go up, and all of these things on the right are supposed to happen, like we just talked about, and our HRV is supposed to go down for a moment until that stress is overcome. Then that parasympathetic system gets reduced because we don't want to be thinking about reproduction when we're running from a lion or sleep, right? So this is normal. And ultimately, all of us and our patients, every human being is at the center of this balance, able at any moment to regulate the balance between sympathetic and parasympathetic, and therefore manage our symptoms more effectively with techniques as simple as deep breathing. It's simple, but it requires a lot of work. But the system is still there. However, we're at the core of it. That's the most important thing. And all of that is regulated by autonomically influencing signals. So it can be sounds, light, touch, breathing, all of those things. So the more things that we surround ourselves by that remind us that we're safe, like soothing, gentle music, soothing, gentle lighting, soothing sounds in general, a soothing environment, soothing touch, all of these things boost parasympathetic activity and help to restore this balance in the system. So why is Apollo interesting? Because Apollo is the first technology that's wearable that works in a similar way as soothing touch to also improve balance in the system. And so when we were first studying this, we were, and all of you are, for those of you who are new to Apollo is a wearable that looks like what you see on the screen. It sends gentle waves, sound waves of vibration that we discovered originally in the laboratory at the University of Pittsburgh and the University of Pittsburgh Medical Center to signal to the body that the body is safe, just like somebody holding your hand on a bad day, just like receiving a hug, just like holding a purring animal. And this is an effect through soothing touch that has been passed down evolutionarily for thousands and millions of years in animals. And in mammals, all of them have these these touch signaling pathways that convey safety to each other. And so this is a very old pathway that we can tap into at any time that we thought Apollo could help with for people who don't necessarily know how to deep breathe, who haven't learned how to meditate, who don't have a yoga practice, and who don't have people to give them soothing touch all the time. And ultimately, the goal with Apollo is to empower people using this technology to have control and remember that they have control over how they feel. We all have control over how we feel with these different techniques. Apollo is one way that people can use to do that. In its wearable form, you can select from 7 different modes, one of which the most energizing is energy and wake up. And then that goes to clear and focused, social and open, going gradually down in energy level or amount of wakefulness, clear and focused, social and open, rebuild and recover, which is one of the more balanced, even patterns, and then meditation and mindfulness, which we have studies showing that mode improves access to meditative states in novice meditators as well as experienced meditators. And then relax and unwind, which is great to wind down the body before bed. And then sleep and renew, which is what most people use in bed to help them sleep. And so these set a kind of structure throughout the day to help regulate and stabilize circadian rhythms, which are our sleep and wake cycles, by giving you a non-drug way to give you a little burst of the energy that you need, or a little burst of the safety and soothing that you need to calm down when you need it and wind down at the end of the day, or get that burst of focus when you're at work and you need to be calm for a presentation. And these are the kind, or you just need to go to the store without having a PTSD flashback. So all these different modes help people with different intentions, different goals when used at different times. And it is very similar to vagal toning. It's very similar to cognitive behavioral therapy with exposure, which is the leading psychotherapy treatment for PTSD that heavily influenced the way that we developed Apollo, which is where you expose people to something that threatened them or that they perceive as threatening with a therapist around to maintain the sense of safety. The person realizes that thing they're exposed to is not actually threatening. It just triggered a threat response because of their experience with it in the past. They reestablish a safe relationship with that experience. And then all of a sudden, as over time, it becomes retrained as safe and something that they can do without having a flashback or a panic attack or an anxiety attack or any of those other things that could happen. So with that, the main idea here is that you can actually deliver this treatment to people. You can deliver this digital therapeutic, I should say, which is what Apollo is to people. And similar to the effects of float tanks, soothing touch, deep breathing, et cetera, when people use it according to our recommendations, which anyone can find on our website, on the article called How to Get the Most Out of Apollo, you will see that you can track improvements in biometrics. And we'll go over some more of those later, but to start, we can track that HRV, heart rate variability, is improving using other wearable technologies in the real world, such as Oura Ring and Apple Watch, and we can also track outcomes in the lab. And to date, we have been involved in 19 clinical trials and studies. 6 of those are complete to date. Most of those are at university sites. We've evaluated Apollo in over 3,700 research subjects since 2017, which is really exciting. And we've used Apollo, it's been used by over 50,000 people in the real world, showing generally consistent results, which is really, really incredible for us, because as researchers, having done this for a while, we realized that most research doesn't work. So when we saw this and we saw the results from the clinical trial that I'll share with you in a moment, and we saw how consistent the findings were, it was showing us that we were really onto something, and that we were onto something that really empowered people to make positive change in their lives as they use it. And from that use, we've seen improved HRV, as I mentioned, improved focus, sleep, feelings of calm, and improved physical recovery. And from that data, we are very happy to note that we've seen that Apollo is not addictive. People do form habits around using it, but it has no withdrawal, no tolerance. People actually get more sensitive to the effects of it over time, and that we've had no significant side effects, which is very, very heartening. And so, and just to give you an idea of the kind of experience that Apollo is, if you haven't tried it, it's like music that is composed at a frequency range that our skin can feel, but that our ears can't really hear. But it is music all the same, and it's music composed for our skin. So some of the stress features of the autonomic nervous system, briefly catch you up, is that actually I think we've already covered all this, so I'll skip to the next slide. And we're gonna talk a little bit about transcutaneous stimulation, which is through the skin stimulation to address stress. And this is what we know so far, which is what led us to discover Apollo, which is that slower oscillations in general across all frequencies, light, sound, vibration, etc., slower oscillations trend toward increases in parasympathetic tone, increases in vagal tone. Faster oscillations trend toward increased sympathetic tone and or a suppression of parasympathetic tone. And so what we thought was, perhaps we can combine slow and fast and maybe get a little bit more control through the experience with people. And so when we started to look at the research that had been done into this, so at that time, this is back in 2017, we thought, okay, well, maybe vibration could help. What data is there? And we saw that slow whole body vibration was associated with increased ratings of pleasantness and increased parasympathetic or vagal tone. Massage and other forms of touch increase vagal tone. Heightened vagal tone or parasympathetic tone correlates with improved attentiveness and emotion regulation. And tactile stimulation, touch, can influence the hypothalamic regulation of the autonomic nervous system, or ANS, activity associated with emotion regulation. So all of this data to date back then was telling us this is something that we should investigate further. And I think somebody just asked, was Bach used for the vibration patterns? We didn't use any specific songs for the vibration patterns. They were composed with math based on our understanding of what we figured out, which is in the lab, that how these different waveforms of combination of slow and fast in different ways can reliably turn the autonomic nervous system a little more sympathetic or a little more parasympathetic. That we figured out how to do in the lab, and then we composed the vibrations for Apollo using a mathematical algorithm to prove to ourselves in the study that I'll describe to you that we really understood what we were doing. Because it's one thing to just take a song like a Bach song and then transpose it down into something that you feel and have an experience. The question is, can you do that reliably, and can you break it down to its simplest parts and understand which parts are actually doing what? And so that was the next step that we took. But classical music was a very big part of our and influence in our understanding of how these frequencies affect the body. So one of the most important works of science that came out in the last 30 years was this work by Bud Craig. And Bud Craig is one of the foremost neuroscientists in the field of the emotional nervous system, and really understanding how not only the feeling of touch or taste or smell, the feeling of the texture of hard, rough, sharp, point, or whatever, or slimy gets to our brain, and our brains interpret that. But then what happens when we have an emotion that's associated with that feeling? Well, it turns out that emotion is stored in a different part of the brain, and that part of the brain is called the insular cortex. And the insular cortex is this part that's highlighted in B and C columns here, and it's the big part of the inside of the brain highlighted in green. And this part of the brain is really important because it is responsible for the memory of all of how we feel when we experience anything, for the most part. And so what's really interesting that was discovered by Bud Craig and his colleagues is that touch, in a lot of ways, is more similar to taste than it is to other forms of stimulation, like pain. And when we touch something in a soothing way, or we have alternating experiences with cold and hot temperatures, that there's a part of our brain that is emotionally responsible for how we interpret that feeling. And it's a very important signaling pathway called lamina 1. And this is critical because it's how we understand that there's a separate pathway in the spinal column where emotional signals go. And so our hypothesis, after understanding all this about the nervous system, was to say, okay, tuned vibroacoustic stimulation, which is what we originally called these Apollo vibrations before there was a company known as Apollo, would decrease subjective signs of stress. We would increase performance under stress. We would increase parasympathetic tone as measured by heart rate variability, heart rate, respiratory rate, and galvanic skin response or sweat, all validated measures of autonomic nervous system activity. That we would decrease sympathetic tone as measured by the same measures, and that we would increase the efficiency of effort. So we would increase the ability to perform more efficiently with cognitive performance and get more work done in less time with less effort. And so the study that we originally did was looking at, this is back in 2017, 2018, when we had no funding except that came from the University of Pittsburgh, and an idea. And we tested that idea in the lab in a completely electromagnetically and sound shielded room where no external signals or interference could get in. And we had people experience Apollo vibrations both on their wrist and chest at different times. And these are healthy folks, and they were all blinded to what they were experiencing. So they didn't know what vibrations they were getting. And we gave them 2 Apollo vibrations, 2 placebo vibrations, which one was a cell phone buzz that's known to increase alertness and wakefulness. Another one was a tapping that is known to calm people down. And then the other conditions were no vibration, and nobody knew what the vibrations were supposed to do or what vibrations they were getting, and they were all delivered in random order. And then we watched people tell us how they felt on the screen by clicking on the screen and reporting to us how they feel within 30 seconds, and then doing a stress task that is called the PACEAT, or the Paced Auditory Serial Addition task, which is a task that's very, very challenging, that NASA gives to astronauts before they go into space to test their ability to do simple tasks under extremely frustrating conditions. It's basically just adding single-digit numbers, but after you do that for 2 minutes, but after you do that for about 30 seconds, pretty much everybody is ready to give up. And what we found from that study initially was that Apollo improved heart rate variability under stress by 2 to 3-fold. We improved cognitive performance by up to 25% in people who, in all the subjects received all conditions. So every subject had their own comparison score to compare to in the study. And we saw cognitive performance go up only in the Apollo frequency conditions, and that mental clarity and efficiency of effort, the amount of effort people were putting in as measured by pupillometry, the change in pupil reactivity over time, was shown to improve. And that was just within 3 minutes under stress in a stress task. So this is, again, another summary of that data showing that with Apollo vibrations, we saw improved calm, improved cognitive performance under stress that was statistically significant, improved heart rate variability that was statistically significant. And this is standard deviations from the mean. And we also saw improvement in the efficiency of cognitive resources within that 3-minute time frame. And again, this is in a laboratory controlled environment at a university, which is why we could see the changes happen so quickly as measured by EKG, heart rate monitor, EEG, electroencephalogram, brainwave monitor, pupillometry, respiratory bands, sweat monitors, and all of that stuff was hooked up and monitoring people in real time while people were doing these different tasks. And so what we saw was that there was a distinct grouping of 2 different groups of people. One group was the group on the left called regulatory control that performed much better. This was about 80% of people that responded to the Apollo vibrations very well. And it increased their performance on the task. It decreased the stress they told us they felt going down from top to bottom. It decreased their sweat response, which is a sign that their stress response is coming down. And it increased their HRV. And there was another group that had the opposite response, and that was about 20% of people. And this is another figure that I'll go through quickly because it's a lot to take in. But this is just showing that people, when they feel the vibrations within 3 minutes, can have distinctly different effects on their heart rate variability and their galvanic skin response. And every vibration has a nickname, and those vibration patterns that we chose were about 20 patterns, and they all did something different to people's bodies. So it was very clear that something different was going on. This is 2 of the Apollo frequencies, frequency 1 and frequency 2, that show in figure A that as HRV goes up, performance goes up. So with Apollo vibrations, there was a linear relationship between HRV, heart rate variability, and performance. Typically in the stress task, the line goes the opposite way because people get frustrated and their performance goes down and their HRV goes down. So the line would go the opposite way. So we saw a reversal of that trend with Apollo conditions. And we also saw that correlated with a reduction in stress. So the 80% of people who responded to Apollo also had a reduction in their self-reported stress score in between the stress tasks. And this is the figure that shows that that Apollo vibrations improve the efficiency of cognitive effort. So not only did people perform up to 25% better on the task, which, to give you an idea, means getting up to 25% questions right on like a math test, for instance, which is huge. What we saw was that no matter whether you were a 25% improvement or a 5% improvement, your effort was more efficient. So the harder you tried, the better you did. And this is the opposite of futility. Futility is defined as the harder you try, the worse you do. So this is, and you don't make any progress, which is extremely frustrating. And so this was a reversal of that futility curve, which is really exciting. And I just shared these results with you and summarized them. And this is the Apollo original research team that worked on this study at the University of Pittsburgh. And a funny picture of me from way back. And this is some of the more recent data that we've gotten that I wanted to share with you that relates more to maybe what we might see in the real world. So this is over 582 people worth, and the results from the study I just shared with you are under review for under peer review currently. This study, we just got the results back, so it's extremely confidential, and please don't share it. But what we found, and we will be making an announcement about it shortly, but what we did find is that people using Apollo for 582 people using Apollo for over a year who had on average 5 months of baseline Oura Ring data on heart rate, HRV, and sleep metrics were showing us that when they used Apollo the way we suggested, which is about 3 hours a day and about 5 days, or at least 3 hours a day and at least 5 days a week of use of the device actually vibrating on your body, we saw that HRV cumulatively in these people went up on average 11%. Resting heart rate went down on average 4%. Average heart rate throughout the whole day went down on average 4%. And sleep went up. Deep sleep, REM sleep, and total sleep, not only very statistically significant, but clinically significant as well, seeing 19% on average increases in deep sleep, 14% in REM, and 6% in total sleep, which also correlated with the shifts in light sleep and sleep disturbances, which is really fascinating. So this is the most exciting latest stuff from people who are just like our clients. They're not research subjects in a controlled lab room. They are people who have been using Apollo for 6 to 12 months, who compared to their own data from the prior 5 months are seeing this kind of improvement when they use Apollo 3+ hours a day, 5+ days a week, and generally following the how to get the most out of Apollo recommendations on our website. So this is really encouraging. And now we're expanding this study to 5,000 people currently. We currently have 1,500 people in the study and are updating the analysis to do much more complex analysis that we're excited to be able to share with you shortly. And I think just to wrap things up, I want to leave you with the idea that we're all in this together and collaboration is critical. We can't make changes to that are real positive and meaningful changes to the way we deliver healthcare and the way we treat our patients, unless we work together to bring our patients the best quality of care and treatment and knowledge that we can get. And to back that up, the average amount of time it takes to get technology from or treatments like heparin, the blood thinner, for instance, from the lab to the clinic and actually be approved for use and in use is on average 17 years. And this is way too much time when we have an epidemic of mental illness, particularly depression and PTSD in the world right now. This is the time for us to rapidly innovate and to work together with not only other clinicians, but also with business people and with financial folks and with engineers and with people who know how to bring these incredible discoveries to life. This is just the first of what I hope will be many new technologies that come into the mental health space to bear the burden of the crisis that we're facing right now. So thank you everyone for joining, and we can take some questions if people haven't asked them already. Let's see. So one question that was asked is, can you explain the differences between microcurrent electrical therapy, cranial electrical stimulation, electrotherapy stimulation, and Apollo? So I did talk about that earlier, but Apollo is sound waves. It is not electrical at all. There's no electricity being delivered to the body. It is only sound wave vibration. And if you put the Apollo into airplane mode using the mobile app, Apollo no longer sends out any radio frequency communication. I mean, it only sends out minimal anyway when you open your app, but it sends out no additional radio communication, and it sends out literally no frequencies except low frequency sound waves. And that is all. So that's how it's different from the other therapies you mentioned, which are all using electricity applied to the body, which can which can have benefit, but it can also have other side effects like burning the skin, increasing skin sensitivity, muscle twitching, and other things that people aren't necessarily that thrilled about and are harder to access and use on the go. And so a big part, we studied a lot of those therapies originally when we were developing Apollo and thinking about making Apollo with electricity. And we realized that when we surveyed people, most people that we talked to just didn't want to use electricity if they could avoid it. And so that's why we ended up focusing on sound-based vibration therapies. So let's see. Got the microcurrent. Is Apollo effective for children with ADD, ADHD, autism, and other neurological disorders? Is it just one tool amongst others that our experienced practitioner will use? How long might it take for an experienced practitioner to master the effective use of Apollo Neuro? From Jack. Thank you, Jack. So Apollo is very easy to use on purpose. We made it so that children could use it. We designed it with them in mind because children oftentimes don't have access to technology. They don't have access to smartphones. And they don't have access to, and they don't want to take medicine. And so if we could have other alternatives, then it would really be a huge benefit to a lot of our pediatric patients who wanted to use something before trying medicine. And so we ended up doing a clinical trial pilot, and we've had over 100 children run through multiple clinics using Apollo so far, but the pilot was in children with treatment-resistant anxiety disorders and trauma disorders and ADHD diagnoses. And what we found was that these kids responded to nothing else. They were kids that were really, really struggling and had tried many courses of medicine and therapy and not had any significant long-lasting results. And we saw a 95% response rate in these children. That was an over 95% response rate, which was really exciting. The kids just loved it and they loved wearing it. They felt much, much calmer having it on their bodies. And they were able to regulate their emotions because they felt calmer. So the kinds of outcomes, and you can read a little bit about this on our website, but the kinds of of outcomes we saw that were so exciting were the children started interacting in their therapy sessions more. They started participating with the therapist. So in that way, you could use Apollo in your office as much as you could also give it to a client to take home with them or have them use one at home to regulate themselves at home. Using it in the office alone is helpful. We have a lot of folks using Apollo with their patients specifically for when they come in for appointments, when they're doing trauma work or doing work with kids that have had very challenging life experiences. And so particularly kids with ADD and ADHD. So the response rates in these children are really quite good. They can use the device on their own. All that needs to be done for a child to use the device if they don't have a smartphone is that the device is connected to the parent's smartphone or to the clinician or clinical provider's smartphone, or if it's in the office. And then you give the child the device and you set it to the mode that you want it to be on for the session. And which, could be any of the modes at a low intensity are generally calming for kids, particularly the social and open and the meditation and mindfulness, relax and unwind, and the rebuild and recover are great for interacting with the kids. And then clear and focus tends to be the best for kids in school or who have to do long extended focused work. And we've seen that this improves productivity and improves engagement with the therapist. It's improving the quality of interactions in school, at home, and in the clinic. So, and the kids control it on their own with the buttons on the device after it's set by the care provider or the guardian. So we've seen great results, and we're expanding those trials now into other clinics and a large university trial that will be a national trial that will be launching shortly for ADHD and ADD, which is very exciting. And let's see what else. Oh, and there was a question about autism. So autism is commonly a disorder that gets confused because of the anxiety that gets associated with it. And a lot of the times there are symptoms that a child or an adult presents as autism that are actually anxiety and not the autism part. And the autism part that they might have, or the autism spectrum that it might be on, might make it harder for them to cope with the anxiety of an experience, and particularly to transition from one state to another or from one experience to another. And then they get stuck. And when they get stuck and they don't know what to do about it or how to interpret how they feel about it or how to communicate it, then they can get aggressive or activated or even violent. And so one of the ways that we are really trying to help people with these, let me end this. So you can see me full screen. One of the ways that people can use Apollo with kids with autism is to have them use it as regularly to help just restore that sense of their own ability to transition from one experience to another. And when they feel like they're able to do that over time, it's actually very calming to them and very empowering, and helps them navigate experiences more effectively on their own. And we've seen this quite a bit in probably, I would say, like a couple hundred adults and children with autism at this point, which is very, very consistent. And really, let them figure it out on their own with some explanation, but there's, they can do it. And when they feel it, they know the feeling, and it's something that they can work with and use to train themselves to feel better. So let's see. Another question was, can one suspect similar effect if the individual suffers from brain trauma, such as seizures? We don't have any studies of people who have seizures at this point, clinical trials, but we have had a number of users who have seizure disorders who use Apollo to calm themselves down, particularly to keep themselves calm at the end of the night and wind down at the end of the day and help them sleep. And those people report that they have great results and don't have any issues or seizure issues with it. They feel that they've told us that their frequency of seizures goes down. But we haven't had any issues with it in the seizure community so far. We have had absolutely wonderful findings coming in from the traumatic brain injury community, people who have had physical head injuries or blast injuries who have really powerful responses to Apollo. Similar to kids, these people are also more sensitive tend to be more sensitive to the vibration feeling than others, and so than healthy people. And so we recommend starting with the intensity lower. The one thing that I can't say enough about Apollo, and please read that How to Get the Most Out of Apollo article. We'll share a link to it in the chat here in a sec. But the intensity of Apollo vibrations should only be and should always start at the sensory threshold. And this is where we just start to notice that we're feeling the vibration or feeling the sense of touch, but it's not distracting. So that's what we call the sensory threshold, which is sub awareness for most people most of the time, meaning that it's not distracting. It's not going to take you out of the element. It's not going to take you away from anything else you're paying attention to, and it's not going to cause any kind of restlessness or discomfort. So that is the goal for all of our clients and ourselves when we use this device. Always start at the place where the intensity is at a level where people just start to feel it. This is personal for every single person. Every person is going to have a different sensory threshold, and it's going to be different depending on the situation they're in. For example, people who are very sensitive might find themselves turning Apollo up to 100% on the sleep mode when they're on an airplane, because the ambient noise of the airplane is so loud that it's overwhelming and they can barely feel the Apollo when it's on 100%. But when they're in bed at home, they might use the sleep and renew mode on 20% or 40%. So this is the most critical part to understand, because this intensity level is the part that we need to explain to our clients, because this is the biggest influence that they have over the experience. Everything else in the Apollo is basically preset for everyone the same except the intensity level. So that is very important to understand. And let's see, next question. I just paired my Apollo with my phone just before signing on, and I have the vibration set to a comfortable level on the meditation portion of the app. And I have no prior experience or time so far to delve into the website. I am in meditative state when it is vibrating or when it is off. So this is a Apollo. We have the ability to be in a meditative state at any time by using breath work, by taking a deep breath and just focusing on our breath and feeling it come into our nose, mouth, and lungs, and doing that a few times. You can naturally induce a meditative state. But when our minds are busy thinking about other things that are not present things, like the past or the future, we're not in a meditative state anymore. The goal of meditation is to train ourselves to be as present as possible, as much of the time as possible. Apollo and soothing touch and breath work and yoga and meditation are all techniques that help us to remember the experience of being present. When you remember, it's called experiential learning or bottom-up learning versus top-down learning, which is what we do as clinicians often, where we tell somebody, this is what it should feel like, do it, right? So the experiential or bottom-up learning is, this is what it feels like to be in a meditative state, or it feels a little bit like this. So this is what you should aim for when you're doing your practices of trying to be more present and more meditative. And the goal should always be trying to be as present as possible, as often as possible. Another good question. So for patients with high blood pressure, how closely do they need to be monitored such that their blood pressure will not go too low? When you reduce SSRI, all right, so there's a couple questions here. So the first one with blood pressure. If you are taking blood pressure, if you have high blood pressure and you are not taking any blood pressure medication, you do not need to monitor your blood pressure while you are using Apollo. Apollo will not make you what we call hypotensive if you are not on medication. It will not decrease your blood pressure to a level that in any way is harmful at all. And it will not decrease your heart rate to any level that is harmful at all, at least not from what we've seen so far. We have no evidence of that. However, there are rare circumstances where someone with high blood pressure or hypertension is taking one or multiple doses of an antihypertensive medication or a medication that lowers blood pressure. In these situations, there are recommendations that are put out by your doctor to have you monitor your blood pressure at a certain rhythm, frequency or cadence. Every so often, you're supposed to check your blood pressure when you're taking a medication, and then supposed to check it when you come into the clinic. And those guidelines do not need to change when you're using Apollo. However, it is important to note that low blood pressure can be caused from these antihypertensive medications, and it's very, very common that we see that happen when we're dehydrated, we haven't had enough water, or we haven't had enough salt, and our body is not retaining water, and those are the two most common situations that result, or we accidentally took too much medicine, or we took our medicine too close together. These are the most common reasons why we can have low blood pressure from the medication. And that when people are taking medications, that's the most common reasons why this happens. Could Apollo lower your blood pressure even more to cause these episodes? We don't have any evidence of that so far, but we do recommend that if you're taking blood pressure medication, that you follow all of the standard guidance around checking your blood pressure when you're taking these medicines. That would apply whether you're using Apollo or not, and make sure that you stay hydrated and that you have a healthy diet that encompasses enough nutrition around the board, and that you also make sure that you stand up slowly when you're lying down in a lying down position or a sitting position, because these are the times when people are most likely to have episodes of dizziness or spinning or low blood pressure hypotensive episodes, is when transitioning from lying down to sitting or sitting to standing. So, or lying down to standing. So make sure to just make those transitions slowly, particularly when you're getting out of bed. And that will, if you're taking these medicines, and that will reduce your chances of having trouble. Another question was, when do you reduce SSRI meds, and generally at what rate? This question is difficult to answer here because I don't, well, I mean, I could tell you how I do it with my clients, but basically the way that we do this is that if I am prescribing the SSRI to somebody or the antidepressant, I make sure that they're feeling like at least by the time that they are seeing me, they either are at a point where the effect of the medicine is non-existent for them, they are not really noticing any benefit, or they are having lots of side effects and they want to come off of it right away, in which case we can do a rapid taper over the course of 2 to 4 weeks, which has to be balanced with how the patient's feeling. If a patient has terrible withdrawal, or it's a SSRI like Effexor or Paxil that has bad withdrawal symptoms, sometimes you need to take it slower. But usually over 2 to 4 weeks, if somebody wants to come off of it right away. And then we would supplement with Apollo use and other natural tools, like certain high quality cannabidiol products can be really helpful for mood regulation. 5-HTP can be very helpful for the sleep component. And of course, things like certain kinds of healthy fish oil and other natural products as supplements can be really helpful for getting somebody on, sort of back into a state of balance. We also, of course, teach breathing techniques. We teach self-touch techniques, and we teach cognitive behavioral techniques to help people through with some skills when they are tapering. If we are working with somebody who's on a stable dose of SSRI and they want to be tapered off of it because of side effects, or they just don't want to be reliant on that anymore, and they are stable, where their symptoms are even, then we work in a very similar way, but often do a slower taper because there's not usually a rush. And we can do that taper over 2 to 8 weeks, depending on the individual patient and how and client, how they're tolerating it. And we just work with them very closely to make sure that we're providing them with tools that can help manage the symptoms that come up, whether those are cognitive behavioral tools, or whether those are technological tools like Apollo, or supplements. We use all of that to help people navigate the taper experience. Let's see, is there another one here? I think the last question, patients that have chronic fatigue syndrome and other conditions, dysautonomia, nervous system dysregulation, should use certain modes versus others, assume the slower vibrational modes. Okay, good question. So this will be the last question for today. Thank you all for joining and for your insightful questions. So for patients with fatigue as a major part of their illness or their experience, they feel fatigued all the time, low energy, lethargic, and really just not motivated. And this can be folks with depression as well as chronic fatigue syndrome. Apollo is extremely helpful when used in the morning, in particular on the more energizing modes. So this would be the energy and wake up, and the clear and focus, and the social and open as the 3 major energizing modes. It is important to note that it's up to each person to choose how they use the mode, how intense they use it, and how long they use it for. So if you go to that article called How to Get the Most Out of Apollo, again, which I think I can share here in the chat, that we have some basic guidance around this, and we'll be providing more coming out soon. But using energy and wake up as a mode, particularly for fatigue, is extremely helpful. It is one of the most energizing modes. It's kind of like, I use it for getting up in the morning for just 5 minutes in the morning on like 20 or 30% intensity. And it gets me going and revved up for the day. And I'm like energized and good to go for my workout, which was always a challenge. And so using that mode can be really, really helpful at any time for fatigue. But that mode, is important to note, can also be very stimulating. And so if anybody who's using it finds energy and wake up to be too stimulating, we recommend, of course, first just turning the intensity way down. And then if it's still too stimulating, move to the clear and focus and the social and open, because those are still energizing modes, vibration patterns that help with fatigue in particular, and motivation and energy, but they are more calming in the way that they are delivered than the energy and wake up. People with anxiety disorders, for instance, typically don't really like the energy and wake up mode, unless fatigue is their major anxiety problem. So energy and wake up is great for fatigue. It's great for needing a burst of energy in any moment. But people who have anxiety disorders but can feel overstimulated when they use that mode at any intensity. And so we recommend that people use that mode at very, very low intensities, or not at all if you have an anxiety disorder, and really focus on the less stimulating modes. And occasionally there are people who have told us that they feel their heartbeat a little bit fast, and they feel a little bit of restlessness in the body with the energy and wake up mode. So again, we haven't had any adverse reactions, but these experiences that people are having are real, and it's important to take into account when we're working with people who might have any kind of cardiac disorder or disorder of restlessness or overstimulation or overactivation in the body that is not fatigue related. Energy and wake up may not be the best fit for them, particularly at high intensities. So as clinicians, I would make sure to note that when you're using this with your clients and recommending it to your clients, that can make a big difference in people's experience. And then there are people, of course, we see people who have anxiety disorders or anxiety in general who love the energy and wake up mode. So it crosses all spectrums, but just some wisdom from the thousands of people that we've worked with and talked to about this to pass on to you. And we really appreciate you taking the time to tune in. and to share this space with us. We will be doing this again. And so come bringing your questions, and we'll get deeper into different topics around the science and the way we treat people in general, and how we can use Apollo to help augment outcomes in those treatments and other techniques as well. And also start to get more into how different supplements could be used in combination with Apollo to improve autonomic regulation and balance in the autonomic nervous system, and also how different breathwork techniques, specific breathwork techniques, can be used to improve autonomic regulation in times of stress, but also just to help you fall asleep or to help you feel more energized and focused when you need some more focus, with and without Apollo as well. So more to come. Stay tuned, and please share this around with anyone you think might be interested. We always appreciate everyone joining us. So thank you so much, and take care and have a wonderful week.